My name is Veronika Levin. I'm one of the obstetrician gynecologists at Johns Hopkins Community Physicians at Howard County. If you find yourself unexpectedly pregnant and you're thinking about when to see your obstetrician gynecologist, just know that you can reach out to us at any time if you have any questions. But we definitely want to see you early on, probably around between 7 to 8 weeks, because we want to answer your questions, give you some advice in terms of what to expect in pregnancy, and also verify your due date and how far along you are. The most important thing is getting that first ultrasound early in pregnancy to establish your due date and also make sure that the pregnancy is in the appropriate location and inside the uterus. Typically what happens is we use the ultrasound on your abdomen. We take a look first, but oftentimes when it's early, we won't be able to see everything. So you typically expect to have a transvaginal ultrasound, which is an ultrasound where the probe goes inside of the vagina, and that gives us a more accurate picture. When you are initially pregnant, you definitely want to reach out to your obstetrician gynecologist. If you have a primary care physician and you feel comfortable with your primary care physician, you certainly can reach out to them. It's not, you don't have to, but if you have, it's different for everyone. So for women who have medical comorbidities like diabetes, high blood pressure, or if they're seeing a neurologist or a psychiatrist because they either have epilepsy or mood disorders, it is important to reach out to your other specialists or your primary care physician so we can all work as a team to get you at your best health in pregnancy and help you make any choices and decisions in terms of what medication you need to be on, what's safe in pregnancy, and what can keep you the healthiest through the pregnancy course. So sometimes when it's your first pregnancy or not even your first pregnancy, there's a lot of questions that sometimes patients have. One of the big questions is some bleeding or spotting early in pregnancy. That can happen in a variety of different situations. So a little bit of spotting is not uncommon in early pregnancy, but that can also be seen with miscarriages and an ectopic pregnancy, which is a pregnancy outside of the uterus. So definitely if you have continued bleeding or spotting and you're having pain that's not going away, you definitely want to reach out to your obstetrician and gynecologist and just talk about the things that are happening so we can talk about what next steps to take. But definitely don't be too concerned in the beginning because even just a little bit of spotting that goes away sometimes can be seen in early pregnancy as well.